Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala Sayyidina Muhammad wa ala alihi wa ashabi ajma'in. All praises belong to Allah subhanahu wa ta'ala. Blessing and salutation be upon our beloved Prophet Muhammad sallallahu alaihi wasallam. We pray that this message finds you in the best of health, and Allah subhanahu wa ta'ala continues to shower His protection and assistance to the Ummah at large. The Islamic Medical Association is a voluntary association of Muslim health professionals. In addition to the various projects that it implements, the Islamic Medical Association has for over 40 years been advising the Muslim community in matters related to health, ethics, and education of the South African Ummah. In view of this, the current message is a position statement of the Islamic Medical Association on the COVID-19 vaccines. The current medical challenge of our time is the novel severe acute respiratory syndrome coronavirus, commonly referred to as COVID-19. Similar to the changing nature of the virus, medical evidence on mitigating the impact and the management of this condition is continuously evolving. South Africa has reported approximately 1.475 million confirmed cases of COVID-19 to date, with an estimated 46,180 deaths. COVID-19 has had an impact on every person's daily life, irrespective of race, gender, religion, profession, or social standing. We have had to change the way we work, teach, learn, shop, travel, pray, and bury our loved ones. Hospitals and healthcare workers have become overwhelmed with the sheer numbers of people requiring care. Similar to other communities, the Muslim community in South Africa has not been spared the impact of the virus. We all know of family members, community members that have been severely affected by the virus with negative consequences such as prolonged ill health, hospitalization, and even death, with a number of people dying within a short space of time. Data collected by Muslim Stats indicate that mortality amongst Muslims is approximately 5% of the total South African mortality. This 5% confirmed deaths due to COVID-19 is likely an underrepresentation, since many people are not hospitalized and dying at home without a diagnosis. The impact of the second wave has been more severe, with a rapid increase in mortality. Over the past year, South Africa, like other countries, have implemented a number of environmental and individual measures as part of a risk mitigation strategy that included, amongst others, lockdowns, travel restrictions, social distancing, restricting social gatherings, amongst others, to reduce the transmission of COVID-19. At an individual level, this involved wearing of face masks, contact tracing, self-isolation, and quarantine. Although these measures may have assisted in reducing the numbers and the impact of COVID-19 across the country, these measures are not sustainable over a long period. There is no definite treatment for COVID-19. Most treatments, such as chloroquine, hydrochloroquine, remdesivir, azithromycin, colchicine, and many others, have been repurposed and aimed at reducing the inflammatory response. In particular, ivermectin has been touted as a potential miracle drug. However, there is very little evidence supporting its use for the prevention of COVID-19. In order to interrupt the transmission of COVID-19, reduce morbidity, mortality, and the negative economic consequences, it is essential that the host immunity is strengthened. Vaccines are the most effective and permanent way of inducing artificial immunity. The benefit of vaccination is at a population level. Enough people need to be immunized to reduce the opportunities for the disease to spread. The virus will not have enough eligible hosts to spread the infection and eventually be eliminated. This is a phenomenon of herd immunity, when a large proportion of the population develops immunity to a pathogen, and this limits the spread by interrupting the chain of transmission. For us to achieve herd immunity in South Africa, it is estimated that 70% of the population need to be immunized. The benefits associated with protection conferred by the different vaccines far outweigh any potential risk of adverse event or serious adverse event. Side effects resulting from injections are mild and subside within days of administration. Most reported side effects include injection area pain and swelling, headache, lethargy, and fever. The risk of serious adverse events are similar to those that may be experienced by using commonly prescribed medication such as aspirin or some antibiotics, which are used widely despite their potential risk. The vaccines do not contain any human or animal ingredients and are synthetically manufactured from derived products in the laboratory. The ethanol used in the manufacture of vaccines and medication is chemically derived and not from fermentation process. The quantity is less than the amount found in common food ingredients. Human cell lines are not part of the ingredients of all the vaccines, and when present are used as the vehicle for production but are not part of the final vaccine. Vaccines do not alter the genetic makeup of a person. Recent studies suggest that some vaccines may have reduced efficacy against the prevailing variant of COVID in South Africa. The virus is changing over time, which is a common scenario with many viruses. Scientists are assessing what this means for our local vaccine strategy. It is likely that even partial protection from a vaccine will reduce the risk of severe disease. It is possible that more than one type of vaccine or repeated vaccination for different strains may be required, similar to what has been used for influenza in the past. After careful consideration of the role of the vaccine, mechanism of action, and its potential impact, we are of the view that the benefits of vaccination outweigh its risk and potential harm. The use of vaccines is an extremely cost-effective intervention and potentially prevents severe disease. The administration of the vaccine makes good economic sense in that it has the potential to reduce the adverse economic costs due to illness on society, and it will allow us to return over a period of time to our normal activities, including our religious observances and being able to travel for Umrah and Hajj. As Muslims, it is our fundamental belief that life and death, illness and good health are all from Almighty Allah, and no intervention can change destiny. However, as mortal beings, it is our obligation to pursue all Sharia acceptable avenues that reduce our risk to adverse circumstances. Based on our current knowledge at this point, and subject to revisions based on the availability of new data that is relevant, the Islamic Medical Association of South Africa recommends immunization for COVID-19 for eligible individuals in line with national guidelines. Individuals should seek the advice of their medical practitioner and make an informed decision based on the best scientific evidence at the time of vaccination. Any benefit that accrues from this advice is solely the favor of Allah subhanahu wa ta'ala, and any shortcomings are due to our own weaknesses. May Allah subhanahu wa ta'ala protect us from what is in front, behind, right, left, and from above us, and we seek refuge in Allah's magnificence from being taken unaware from beneath us. Subhanallah wa bihamdihi, Subhanallah al-Azim. Assalamu alaikum wa rahmatullahi wa barakatuh.